Well, ahead of International Nurses Day on Sunday, nursing services in South Africa are hampered by a declining number of new nurses, a shortage of specialised nurses, and an uneven spread across urban and rural areas are just some of the challenges. Now, excessive workload has contributed significantly to the dissatisfaction of public and private sector nurses in South Africa. So how do we retain our best nurses in the country? Well, to answer that question, we are joined by Dr. Nceba Ndzwayiba from Netcare, who joins us now digitally. Dr. Ndzwayiba, good morning. Good morning to you, and thank you so much for joining us. Just how extensive, in your view, is the shortage of nurses that we face in the country? Let's start there.
Good morning, and good morning to your viewers, and thank you for having me on your show. I think before I start delving into the shortage of the nurses, I just want to wish all the nurses a happy Nurses Day. On Sunday, the 12th of May, will be the International Nurses Day, just to express our huge appreciation for the incredible work that they do. So Naledi, the shortage of nurses is a global phenomenon. The World Health Organization has told us through various publications that there's an estimated 10 million shortage by 2030 of healthcare workers, and half of those will actually be nurses. If we come to the South African context, we've had several publications that have been issued. They estimate the shortage to be above 27,000 at this point in time. And if we do not do anything about that, the estimates are that is likely to increase to about 70 to 100,000 by 2030.
Yeah, I mean, that's very, very serious. What is it that we're doing wrong then in encouraging new nurses into the sector?
So the key contributing factor to this challenge is the fact that we are not producing sufficient numbers of nurses to be able to join the profession. It is not necessarily the lack of interest from young people. South Africa has a huge unemployment issue, and there's a lot of young people that do want to take up the profession. However, we've had a dispensation where we've transitioned from the old legacy qualifications into the new higher education aligned qualifications. And during that transition period, we've seen a drastic reduction in the number of nurses that both the private and the public sector are able to train. Just to give you context, the private sector groups alone have had a nearly 65% decline in the number of nurses that they are able to produce. So this actually tells us that there is capacity. The capacity does exist, and there is will from both the private sector and the public sector to be able to do this. But there has been some regulatory constraints and with active engagements on trying to resolve these.
What are those regulatory constraints that lead to a 64% decline in training new nurses?
I think part of the challenge has been the transition from a change management point of view. There has been this fear that, look, we are transitioning into newer qualifications that have not been implemented before. They are pitched at a higher NQF level, and therefore the South African Nursing Council has taken an approach that it should gradually monitor the throughput rate, the quality of the students that are being produced, and the ability of the nursing colleges to be able to sort of like deliver on the new curriculum.
Yeah.
While that is valid, the truth is it's actually been a couple of years now since those new qualifications have kicked in. And we do believe that the private sector institutions have demonstrated track record to produce high quality nurses. I mean, if I look at what we have done from a Netcare perspective alone, we've actually trained more than 50,000 high quality nurses over the last couple of years. And right now, we are actually training about 450 odd per annum, when we usually train more than 2,000 per annum.
Goodness. Are you able to explain, perhaps in a little bit more layman terms, what those new skills are that really are the stumbling block, where the curriculum is there, but we simply aren't training those new nurses? What are those particular new skills? Because I think to the layman, we wouldn't understand. We just want to see more nurses in our health facilities. What are those particular skills that we need to get right?
Look, the legacy qualifications, they sort of like allowed somebody with a grade 10 I need to think carefully about that because I'm a standard person. That's a standard 8 to actually enter the nursing education training at an enrolled nursing assistant level, progress to an enrolled nurse level before they can actually do a 2-year diploma to become a registered nurse. Now we've sort of like seen a curriculum change that says pitch these at a post-schooling level, which is NQF level 5, starting with a national higher certificate in nursing, and followed by a diploma in nursing, which is a 3-year diploma, depending on where you're doing it. And some institutions offer it as the universities particularly offer it as a 3 to 4 year degree. Yeah.
I mean, it's interesting because then I wonder what the conversation needs to be then to encourage young ones that do want to enter the space of becoming nurses when we do have this slowing down of needing to train them. What needs to be done? I mean, do we need to be running campaigns? Is this a conversation that needs to be happening with government as well?
So this challenge requires the collaboration, and I must actually state that there's been some encouraging engagements that have been taking place between the private and the public sector. There is intent to collaborate, and there are engagements that have been happening which are promising to deliver a solution. We do wish that the pace could be a little bit faster, and we remain on the table to be able to discuss those. The single most important solution to this is the regulatory bodies allowing the private nursing education institutions to train larger numbers of students. So it is not necessarily the lack of interest from the students per se, but rather the restrictions on the numbers. And there are engagements that are happening at this point in time with the National Department of Health, with the South African Nursing Council to say, how do we overcome these barriers?
We also we have a barrier of bringing new nurses into the space, but we seem to be losing some of the highly skilled nurses as well. I mean, what are we doing wrong? We're unable to retain them. I know, in the medical fraternity, so many nurses are speaking about the opportunities that are available abroad, in the Middle East, in countries such as Canada, where there is a great demand for them. I mean, there was a survey conducted by the South African Medical Council that said as many as 38% of its members intend to leave South Africa. That's in response to the anticipated implementation of the NHI scheme. I mean, just how big of a challenge do you understand that we're losing nurses in the country?
Yeah, look, I mean, we have multiple challenges. Yeah. We do not only have sort of like an aging nursing population, where almost 50% of currently registered nurses are above the age of 50, and we're producing fewer ones that are entering the profession. But we are also facing a retention issue. As I indicated earlier on, this is a global challenge. If you look at the larger economies, they're facing exactly the same crisis. And they're actually looking outside of their own countries to be able to attract the talent. So it's really, really becoming a huge challenge because, I mean, how do you compete with dollars and euros from a retention point of view in exchange for a rand? So we firmly believe that our largest or the biggest single solution that we really need to work on at a fast pace is beginning to see staff development, pipeline production as part of the retention package itself, because then that actually ensures a sustainable supply of the skill. We also do believe that we all need to think very critically around how do we look after the workforce that we have at this point in time, from a wellness point of view, from a fair and competitive remuneration point of view. How do we rethink work-life balance? So there's quite a lot of work for all of us, and we firmly believe that the biggest solution here is being allowed to produce more nurses and be able to adequately resource the healthcare system and create the much-needed employment opportunities for young South Africans.
Yeah, I think the demand for our nurses in other parts of the world, certainly, even though this is a concerning issue, is confidence boosting. That certainly there's the idea that we produce really great health practitioners, but we're going to have to leave it there. Dr. Nceba Ndzwayiba, thank you so much for speaking to us. He, of course, is speaking to us there from Netcare.